He's the real-life good doctor, a Johns Hopkins emergency physician using his medical talents to save lives in disaster zones.
ABC 2's Mallory Safaste with Dr. Michael Millen, who just returned from Puerto Rico.
Dr. Millen is a member of the Federal Disaster Medical Assistance Team. The team is made up of 5,000 medical professionals from across the country, and as soon as they're called, they drop what they're doing, put their lives here on hold, and head to disaster zones to provide whatever care they can. The elite league of medical professionals is used to working in hospitals like these. But when they're deployed, they work in conditions like these.
There's very little use of labs and x-rays. It's a lot of thought and difficult living conditions. So it's not the right thing for every doctor.
It's the right thing for Dr. Michael Millen. He first got hooked when he traveled with a team of Hopkins physicians to assist in the aftermath of Hurricane Katrina.
When I came back from Katrina, I felt like this was something I really wanted to be a focal point in my career. So I started exploring what this was all about and discovered the DMAT program.
He applied, they accepted him, then he went to Haiti.
We were there about 72 hours after the earthquake and there for about 2 weeks straight.
This year, hurricane season caused massive devastation, wreaking havoc on much of the southern United States.
I deployed to Florida to support efforts for Hurricane Irma. I was home about 2 weeks, and then I deployed to Puerto Rico to support efforts from Hurricane Maria.
Comerío is a town of about 20,000 people. For 17 days, Dr. Millen took care of patients in a makeshift clinic running off generators and traveled through mountainous terrain for house calls.
There was a patient I saw who was in a building, very small home. Right next to her home, the entire home had slid off into the mountainside. Power infrastructure entirely down, with trees down all over the power lines. And that's 4 or 5 weeks after the hurricane, with that amount of destruction still in existence.
They saw people with chronic conditions left without care or medicine. They treated an outbreak of eye infections and healed many with dog bites and skin infections.
In the 12 days we operated the clinic, we saw just over 400 patients.
Dr. Millen was part of an 11-member team. They slept on the floor, dealt with unsanitary living conditions, a situation most look forward to leaving behind. Not so for Dr. Millen.
I have a wife, I have kids, I've got great work I do at Hopkins, and so there's another life as well. So sometimes it's actually the opposite. You have to remind yourself of the rest of your life. Because it's easily get trapped into a disaster. It's very hard to leave. There's a part of my heart that will always be in Puerto Rico. There's a part of my heart that still lives in Haiti. Every time I've deployed out, a part of me stays there because the work is so meaningful to me.
Before Dr. Millen left Puerto Rico, his team formed a partnership with local pharmacists, physicians, and activists to better help stabilize the community, because while he loves what he does, their goal is to give the community what it needs to survive on its own, then move on. For ABC 2 News, I'm Mallory Safaste.